These are my 5 people. Lively crowd.
Yeah, boy.
Alright. Some people may be involved with workplace violence or observe workplace violence. The healthcare setting is one of the most common places for workplace violence to occur. Some objectives, I'm going to tell you why it occurs most often in the workplace setting or in the healthcare setting, tell you what you can do to identify threats and how you can prevent it or respond to the situation. Workplace violence is any violent act directed towards persons at work or on duty. Most assaults in the healthcare are by patients, or they could be by family members, coworkers, vendors, employees, or colleagues. It is most likely to occur in the healthcare setting in psychiatric units, emergency rooms, waiting rooms, or geriatric units. It occurs most often in the healthcare setting than any other setting. About 35 to 80% of all staff have reported that they've been victims of at least one assault. Women are more commonly involved rather than men, and fewer than 50% of these nurses actually reported the assault. Alright, some reasons why it occurs in the healthcare setting. Working with the public carries an inherent risk. There is added stress to the situation. Visiting hours aren't restricted. Patients with head trauma, seizure disorders, dementia, alcohol, or drug withdrawal can be understaffed, can have long waiting room hours, and if you work alone or don't have adequate security or poorly lit corridors. And some different threats and threatening behaviors that you want to take note of are people who may be waving their fists, throwing objects if they have a verbal or written threat, slapping, hitting, biting, shoving, kicking, beating, or pushing. Attacks with weapons could involve knives, firearms, or even a bomb. Preventing violence in the workplace setting, zero tolerance policy must state clearly what will happen if violence or the threat of violence occurs. For staff and clients, anyone who becomes violent or exhibits threatening behavior must be reported from the setting, must be removed from the setting, and the authorities need to be contacted. Employees need to be educated to recognize the warning signs of violence and potential assault, taught conflict resolution skills and de-escalating tactics. Environments, just make sure there's adequate lighting, security devices, curved mirrors in the hallways, and safe work practice, adequate staffing, alert staff about patients with histories of violent behavior. Different ways to recognize escalating violence would be if you see someone with a clenched fist, blank stare, fighting stance, which is 1 foot back with arm pulled back ready to strike. If they're standing too close to you or advancing towards you, or avert intent, which means they say there's something like they're going to kick your butt or something similar to that statement. Or if they have movement towards the exit to prevent you from leaving. Different ways to respond to this violence could just remain calm. You want to isolate the individual, watch your body language and keep it simple, clear and direct language. Embrace silence and maintain moderation in speech, calm, normal volume, and slow rate. And violence follow-up policy. You just want to be certain that everyone's safe and that if there's anyone injured, to make sure that they receive adequate treatment. You want to contact security and just follow up with the injured to make sure that everything turns out good. And preparation and education are the #1 ways in which organizations can reduce risk of workplace violence. So remember to watch for escalating behaviors, and if violence occurs, be sure that everyone is okay and report it to security right away.